Good morning, everyone, or good afternoon, or good evening, wherever you are in the world, and welcome to the fourth in our six-part series, Global Antimicrobial Resistance Webinars. Today's webinar topic is engaging the public in antimicrobial stewardship. My name's Professor Angharad Davis. I'm a medical microbiologist by background and clinical director for publishing and engagement at the Royal College of Pathologists. And it's my privilege to be the chair and moderator of this series of webinars. Our aim is to create a platform where all our international members can join to share experiences and good practice. Before we get into today's presentations, I just want to provide an overview of the series for you. The six-part series started on the 5th of June, and we're running a webinar a week until the 12th of July. And each webinar starts with the UK speaker providing the introduction to the topic and outlining the UK's perspective. And then we hear from speakers from countries around the world. And as you can see, we've had a really great range of countries represented. The next webinar next week will be on the 3rd of July, and that one will be on developing prescribing guidelines, where we'll hear perspectives from Egypt and India. And on the 12th of July, we'll be looking at evaluating an antimicrobial stewardship programme. What are the measures of success? With speakers from Canada, Egypt, and Hong Kong. This shows the link to the college conference webpage where all these webinars are advertised. Please bear in mind that if you want to join each webinar, you'll need to register for each one individually via the college web pages. So this is the agenda for today's webinar. We will have the topic introduction and UK perspective, followed by our presentations from Egypt and from the United Arab Emirates. And afterwards, we'll have a Q&A session. If you've got questions for the panel, please enter them in the Q&A as we go along, as they come into your mind. Please feel free to enter them in the Q&A at any time, but we won't take the questions in between the speakers. We'll take all the questions together at the end, so we'll save them up to the end. So, to provide our topic introduction and a UK perspective on engaging the public in antimicrobial stewardship, I'm delighted to welcome Dr. Edward Bevan. Ed is a consultant microbiologist based at Swansea Bay University Health Board and honorary senior clinical lecturer at Swansea University Medical School. He undertook his training in medical microbiology as an academic clinical fellow at Royal Liverpool University Hospital and then at the University Hospitals Birmingham. His PhD thesis is entitled The Molecular Epidemiology of BLA-CTXM Resistance Genes in the Fecal Microbiome of Humans Acquiring ESBL-Producing Enterobacteriaceae. So I'm delighted that Ed's been able to find time to join us. Thank you very much, Ed, and over.
Thank you very much for the introduction. Let me share my screen. So welcome, everyone. So I'm going to start with a little introduction on public engagement, and then I'll talk about what's going on in the UK in terms of public engagement and antimicrobial stewardship. So why do we need public engagement? I'm not going to dwell on this, but I think it's just important to outline. Obviously, antimicrobial resistance is an immense threat to healthcare across the world. I put on the slide there, you can see this One Health agenda. So the concept of human medicine, human food chain, environment, and animal husbandry and agriculture. And I think if we're going to address the problem of AMR, then obviously we need to address all of these areas, and we really need to engage the public and enthuse the public into tackling AMR in all of these domains. And so I've put on the right there, this is the UK's plan recently published, which I'll come on to in a few more slides. But there's some quotations there as well that are taken directly from this this document. So I think it's just important to think of it as a broad brush approach, really. So how can we engage the public? Well, there's a few key avenues that we need to use and that we do use. So one is social media. Another one is public communications, for example, advertising, whether that's posters, banners, or through television, radio, and so on. And then we've got annual events, which really links into both of those points above. So we've got World AMR Awareness Week, which is led by the World Health Organization, which runs in November every year. And we've also got European Antibiotic Awareness Day. And both of these are opportunities to really push the message, and every year to develop a targeted campaign looking at public communications and social media and other events. And both of these organizations, if you like, have got resources online that can be freely downloaded and used. And then I think it's definitely worth saying that patient interactions that we have as healthcare workers present an opportunity for discussion and education, whether that's through the physical interaction with patients, but also patient information leaflets as well, just to improve education and patient engagement in the AMR agenda. So what's happening in the UK? So the UK perspective, as I mentioned, this document, Confronting Antimicrobial Resistance 2024 to 2029, was published recently. And it's an overarching document looking at the whole One Health agenda. But there is a section on public engagement. So it does highlight that as being an important target and outcome. And so if I delve into that a little bit more, so this is the outcome taken from the 5-year action plan in the UK. And so they say by 2029, the public are empowered and equipped to engage on and help address AMR through an improved understanding of the scale and nature of the risk and the individual behavioural actions that can be taken to address it. So what are the proposed ways in that we can achieve that? Well, there are 3 main ways. The first one is to launch and evaluate evidence-based campaigns like Keep Antibiotics Working media campaign, which I'll come on to shortly. Secondly is to utilise educational settings, particularly schools, using tools such as eBug, which I'll again come on to in a few more slides. And thirdly, to publish an AMR public engagement guide. So campaigns then, one that I've just mentioned, Keep Antibiotics Working. So this is something that has been around for a few years now in the UK, but it's something we're looking to replicate and build on in the coming years. So this started off in 2017 and ran for 3 years as a national media campaign centered around singing and dancing antibiotic pills on TV and radio. You'll be disappointed to know I haven't embedded a film of singing and dancing antibiotic pills, but if you look at it online, it's worth a watch. So the aims were to raise awareness of AMR and reduce inappropriate antibiotic use. And the advert of the animation was the central part of it, but there were also other resources like posters and a social media campaign. And one of the posters is on the left there. So you can see taking antibiotics when you don't need them puts you and your family at risk. So it's sort of concise messaging there. The campaign was evaluated and published in Eurosurveillance. I put the reference at the bottom of the slide there. So the study used questionnaires and interviews before and after exposing the public to the campaign. And outcomes were quite positive. So it showed that there was improved public awareness of declining antibiotic effectiveness. There was increased concern about AMR after participants had viewed the campaign, and patients reported they were less likely to ask their GP for antibiotics. And also GPs who had been made aware of the campaign and seen it felt more confident to say no to patients who requested antibiotics when they were not clinically indicated. Although the media campaign itself has ended, the posters and digital resources are still freely available online in 13 different languages. So the other UK campaign I wanted to mention, which is linked to the first one there, this one is called Antibiotic Guardian. And this is originally launched in 2014, actually, but is still ongoing. And this is a pledge-based campaign. So it invites interested individuals to become an antibiotic guardian. And essentially a website, which I put on the left there, invites the participant to give a pledge, basically, whether you're a healthcare worker, member of the public, or whether you're a student, educator, or scientist. There have been more than 207,000 pledges made from people across more than 120 countries about how they plan to make better use of antibiotics and contribute to tackling AMR. There are also patient stories on the website, so you can really put a personal message context in there to view for anyone that wants to go and have a look. And social media campaigns align with the World Antimicrobial Awareness Week and European Antibiotic Awareness Day. So moving on then to educational campaign for children and young people. So this is eBug. So this is an international educational resource covering the world of microbes and disease, devised by the UKHSA as an IPC learning journey. And it really goes from the age of 3 all the way up to adulthood. And it's centered around lesson plans, worksheets and activities for young people. So from the age of 3, for example, we introduce concepts of hand hygiene. And then up to the older children, there'll be topics on useful bugs versus harmful bugs, antibiotics, vaccinations, and STIs as well for the older children. So there are resources there for teachers, community educators and trainers as well. And the resource is extensive, it's free, and it's been translated into 27 languages. So coming back to where I'm from, so I work in Swansea, which is in Wales in the UK. And we use many of the resources that I've just described, and we do focus our public engagement activities around World Antimicrobial Awareness Week and the European Antibiotic Awareness Day, and that's through social media. It's through activities directly facing the public. For example, last year, I know some colleagues in a neighbouring hospital in Public Health Wales set up a public stall at Cardiff Central railway station to engage the public on these issues. And our local microbiology team, which includes the biomedical scientists, clinical scientists and doctors, run an annual summer school for children aged 14 to 16 at a local school, and that's just an image there of the recent engagement, which was a case-based learning for the kids. Finally, I'm going to talk about patient engagement a little bit more and how we can do that and where the resources are to help develop that aspect of public engagement. So on the left-hand side there, that's an image from Antibiotic Research UK, which is a charity providing support and resources to patients and prescribers. And then below, we've got Target. So Target is a toolkit designed to support primary care clinicians to champion and implement antimicrobial stewardship activities. So these are resources really designed to help healthcare professionals have those discussions with patients around when and when not to use antimicrobials. And here is an example of a patient information leaflet from the Target toolkit. So Target has resources aimed at lots of different infective conditions, and one of them is urinary tract infection. So the aim of this, I've taken a snapshot of the leaflet. This is only a part of it, but obviously it's explaining what is a UTI, and then it goes into detail on what can the patient do to help themselves. So what are the self-care things they can do, particularly focused on hydration. There's also a section which I haven't put up, but on safety netting and what are the warning signs to look out for, when do they need to seek help if things deteriorate. And then how can we adapt these sort of national campaigns into local guidelines? Well, in the UK, many of you will know that many hospitals and trusts, health boards use microguide. So this is an app also available on Windows as well. And in Swansea, we use it. So we have our local antimicrobial prescribing guidelines on microguide. So all the prescribers can have it on their phone if they wish. And that also includes resources to help engage the public. For example, with recurrent symptomatic lower UTIs, which I put up here, we've got sections on self-care. We've got sections on antibiotic sparing strategies. So, for example, methanamine, hippurate, and vaginal estrogen for these specific cases. So this is a way that we can sort of improve our antimicrobial stewardship and engage the public on these alternative strategies, alternatives to antibiotics. So that's really all I was going to say in way of introduction and signposting to the UK perspective. So diolch am gwrando, thank you for listening, and I'm happy to take any questions at the end after all the speakers have finished.
Well, thank you very much, Ed, for that great summary of the campaigns that have been going on in the UK over the last few years. We're looking forward to hearing the experiences of the other countries. So let me just share my introductory screen for our next speaker. So our next speaker is Dr. Abdelmonem, who is joining us from Egypt. Dr. Rayman Abdelmonem is a consultant of medical microbiology and public health. She has a particular interest in bone infection management and medical microbiology innovation and practice improvement. So really grateful to her for joining us today. Thank you very much, and looking forward to hearing the Egypt perspective on this. Thank you.
Thank you, Dr. Davis, for this introduction. Can I see my slides?
Yes, we can. Thank you.
Okay. I would like to thank the Royal College of Pathologists for giving me this opportunity. And today we are talking about engaging the public in antimicrobial stewardship from the Egyptian perspective. So, to engage the public in antimicrobial stewardship in Egypt, it requires understanding of behaviors and attitudes towards antibiotics. So in Egypt, studies determine three main causes behind antimicrobial resistance AMR. The first one is the availability of antibiotics, which can be handed out at pharmacies on patient demand. And the second reason is the self-medication, which is a common practice and the top reason behind AMR. In the mentioned study, a surveillance targeting physicians and pharmacists was performed to rank the factors behind AMR. And we can see in this table that the self-medication was on top of these factors, leading to incorrect duration, incorrect choice of antibiotic, in addition to patient non-compliance, which end up increased rates of AMR. The third reason is the wrong practice by physicians and pharmacists who prescribe antibiotics for colds and viral infections. And in this table, we can see that almost 80% of pharmacists and 63% of physicians prescribe antibiotics for cold, most times and sometimes. Only 19% of pharmacists and 36% of physicians never prescribe. And almost 81% of pharmacists and physicians prescribe beta-lactam antibiotics, leading to higher AMR in this class of antibiotics. From this figure, we can see that incorrect prescription is much higher than correct prescription when antibiotics are not indicated, either in adults or children. And on interviewing physicians and pharmacists about factors influencing their prescribing practices, the patient demand was on top of these reasons. So the patient demand and behavior are the main culprits behind the AMR, which are attributed to the low level of health literacy and consequent low level of awareness about antimicrobial resistance and stewardship. So what is the level of awareness about AMR? According to the 2015 WHO multi-country public awareness survey about antibiotic resistance, the awareness levels of AMR were variable between participating countries. As we can see in this graph, 89% in Mexico have awareness level, while only 22% in Egypt have awareness level, which suggests the need to focus on raising health literacy among public in Egypt. So what is the health literacy? According to CDC, it is the ability to obtain health-related knowledge, understand, and apply it to improve the quality of life. So, according to this publication, does youth in Egypt have sufficient health literacy? Actually, studies ascertain that limited health literacy was prevalent, and it doesn't correlate with the level of education. So the higher education without devoted programs to raise health-related knowledge may not positively impact the health literacy. And why we are talking about youth in specific? Because youth can lead community change through raising awareness and correcting confusions, which help identify the community needs to be engaged in the antimicrobial stewardship. So, the CDC published the action plan needed to raise the health literacy, which contains the following 7 goals. The first one is develop and disseminate health and safety information, promote changes in healthcare system, incorporate accurate health and science information and curricula in childcare and education through the university level, support and expand local efforts to provide adult education, build partnerships and develop guidance and change policies, increase basic research and development, implementation and evaluation of practices and interventions to improve health literacy, and lastly, increase the dissemination and use of evidence-based health literacy practices and interventions. So, after raising the health literacy and level of awareness about AMR among public in Egypt, they are almost prepared to be engaged in the antimicrobial stewardship. But what is the importance of public engagement? Actually, it plays a pivotal role in antimicrobial stewardship by influencing community behaviors, attitudes, and perceptions related to antibiotic use. Here we have strategies for engaging the public community in Egypt. The first one is public awareness campaigns that utilize various media channels. The second one is the community outreach programs through collaborative initiatives involving healthcare providers, community leaders, and local organizations to organize educational events on antimicrobial stewardship. The third strategy is the school-based education through integration of antimicrobial stewardship education into school curricula to implant habits of responsible antibiotic use among children and adolescents. And the last strategy is the healthcare provider-patient collaboration through promotion of shared decision-making between healthcare providers and patients regarding antibiotic treatment, supported by evidence-based guidelines and patient preferences. So, in Egypt, the stakeholders and tools needed to implement the public engagement strategies are illustrated in this infogram, and they are healthcare professionals, pharmaceutical industry, policymakers, communities, schools and sports, parents at homes, media, health education, farming and animal food. In Egypt, we had the Egyptian National Action Plan, NAP, for antimicrobial resistance from 2018 to 2022. And the objectives of Egyptian NAP were aligned with the 5 strategic objectives of the Global Action Plan, GAP. And as we can see in this diagram, the 5 strategic objectives set out in the Egyptian NAP where the first one was improvement of awareness and knowledge of antimicrobial resistance, which is the most important objective. The second one is the enhancing surveillance of antibiotic resistance and antibiotic use. The third is the proper infection prevention and control practice, optimizing the use of antibiotics in human and animal health. And lastly, promoting research and sustainable investment in new medicines, diagnostic tools, vaccines, and other interventions. So, in the Egyptian NAP, the main principle was the One Health approach with human health, animal health, and environment. And here we can see the educational activities for different learning groups on antimicrobial resistance done in Egypt. And this picture shows the interconnection of 6 domains in which the antimicrobial One Health approach should be integrated, which are the caregivers, society, healthcare students, college students, high school students, and children. So it's all about the educational activities and knowledge dissemination. According to this publication, and on assessment, the public awareness campaign, which was the first objective of Egyptian NAP, researchers concluded that the knowledge about antibiotics was increased because of the awareness campaign. In addition, awareness campaigns helped in correction of some misperceptions. And on the assessment of the whole Egyptian NAP, there were multiple challenges regarding the achievement of NAP objectives. According to this publication was performed in Egypt. The first challenge was the lack of implementation of One Health collaboration concept in applying the National Action Plan through the absence of the environment health activities. The second was the lack of legal provisions mandating the NAP implementation in different sectors. The third was the lack of reporting system to promote the accountability and transparency of NAP stakeholders. The fourth was the weak sustainability triggers within the policy design of the NAP. And the last one is the unavailability of any public awareness survey to understand the knowledge gaps between the public and healthcare providers. And actually I believe that working among these limitations will improve efficiency of the next National Action Plan, which will ensure much more improvement of the public engagement in the antimicrobial stewardship. And actually, recently, in the last couple of weeks, the government has prohibited the sale of certain antibiotics in pharmacies for public. These antibiotics are treated as last resort options to treat infections caused by multi-drug resistant organisms. And they are categorized by the WHO as reserve antibiotics, like aztreonam, ceftazidime avibactam, and colistin. So although it's a late decision, but we always say that better late than never. That's it. Thank you very much.
Great. Thank you very much for that information from Egypt. Really, really interesting to hear about the progress of your National Action Plan as well. Remember, everyone, if you have any questions for the panelists, please do put them in the chat and we will come to them after our next speaker. So our next speaker, who I'll introduce now, is Professor Godfred Menezes. He has worked as a microbiologist internationally in India, Saudi Arabia, the Netherlands, and other countries, but is now based in Ras Al Khaimah Medical and Health Sciences University in the United Arab Emirates. He's authored over 60 research articles, especially in fields relating to diagnostic microbiology and antimicrobial resistance. He leads or co-leads several national and institutional committees related to microbiology. So we're looking forward to hearing the viewpoint from UAE. Thank you very much, Professor Menezes.
Yeah, many thanks, Professor Angharad, for this opportunity. And the previous speakers have given a wonderful background to my presentation. The topic is engaging the public in antimicrobial stewardship, UAE, United Arab Emirates perspectives. So as we are aware, AMR is a major global health issue with millions of deaths attributed to it. And the misuse of antibiotics in both hospitals and community setting has worsened the issue over the years. And in the community settings where majority of the antibiotic use happens, or prescribed up to 80%, we often see inappropriate use contributing significantly to AMR. And AMS, antimicrobial stewardship programs, are critical as they are multifactorial, leading to critical optimizing antibiotic use, improving patient outcomes, and reducing AMR. And these programs traditionally implemented in hospitals need to be extended or expanded into community settings where pharmacists play a crucial role in promoting responsible use of antibiotics and reducing the issue of AMR over the years. In the UAE, we do have AMS programs. We have produced several health regulations and guidelines for AMS programs. To name a few, Abu Dhabi Antimicrobial Stewardship Program, Dubai Antimicrobial Stewardship Task Force, Sheikh Khalifa Medical City Antimicrobial Stewardship Program, Cleveland Clinic Abu Dhabi Antimicrobial Stewardship Program, Rashid Hospital Antimicrobial Stewardship, as well as Tawam Hospital Antimicrobial Stewardship Program. In recent studies, couple of studies, it showed very high prevalence of the self-medication of antibiotics without prescriptions in the population. And these studies emphasize the need to improve public awareness and encourage UAE pharmacists to participate in several programs to optimize the rational use of antimicrobials. In a recent pilot questionnaire-based study, we saw that the good news is that up to 80% wanted to learn more about prevention of AMR, and all of them prefer taking medical advice before starting prescription of antibiotics, and up to 60% felt that there is already AMR awareness in UAE, and it was alarming to notice that up to 20% each had experienced side effects of antibiotics and thought it is not much to complete the course of antibiotics, thought antibiotics work also against virus, and they took antibiotics without any prescription. So since 2016, I've been personally been engaged in engaging the public in training about AMR as well as AMS programs, and to define few roles: co-chair of Institutional Infection Control Committee, member of UAE Higher Committee for AMS or Antimicrobial Resistance, member of Emirates Society of Clinical Microbiology, chair of the scientific committee or board member of Emirates Society of Clinical Microbiology, and professor and chairperson of medical microbiology. So to name few events which we conducted over the years, starting from 2016, ACRES 2018 Symposium on Antimicrobial Choice and Resistance Update, and hands-on workshop on detection of molecular mechanisms of antimicrobial resistance. So this workshop was conducted mainly to train public, mainly the researchers around, in carrying out the experiments and interpreting their findings and reporting the findings as well. And there was also one more workshop on surveillance of antimicrobial resistance, which was also a hands-on workshop. And these workshops were conducted along with the government and private hospitals in UAE. These are some of the pictures associated with the events conducted previously. So the public was mainly interested in hands-on workshop, and they were asking for more workshops where we trained them the phenotypic and genotypic detection of AMR, as well as interpreting them and reporting them in the hospitals as well as in the clinics. Yeah, so there was a major symposium. It was a very successful symposium where we had more than 250 participants, and it was well supported by industries, and it was a CME accredited event. So we did have concern during COVID regarding rise of AMR, but our personal experience was that there wasn't any drastic change in the AMR during the COVID, mainly because of all the preventive measures taken during the COVID. And we have published a series of papers related to AMR in the recent, in the past 2 years. So these are a few more of the scientific events which we partnered along with other societies in the UAE, like Infectious Disease Society and other societies. And we do try to have campaigns during World Antimicrobial Awareness Week, like the previous speaker said, during the November month of every year. And in 21, we did have a very successful webinar. And in 22, we tried reaching out more to the public and engaging in community activities, where we had quiz competition on AMR and AMS related activities. And also we had a poster competition inviting students from different schools and colleges, where it was well appreciated. And the theme was regarding AMR and antibiotic use. Yeah, so many thanks, and looking forward to the questions if you have any.
Thank you very much, Professor Menezes, for sharing your experience from UAE with us. Really great to hear about those initiatives. In a minute, we're going to start our panelist Q&A, and I can see we already have a couple of questions. If you have a question for any of the panelists, please do enter it in the Q&A. But before we go on to that, I think the international team is just going to run a quick poll. They want to capture the countries that you are dialing in from. So I'll just give the international team a moment to run that poll. And if you could just quickly enter your country that you're attending from into the poll, then that would be a great help to us, because we don't have any other way of capturing that information. I'll just give you a few seconds to do that. And in the meantime, Professor Menezes, do you think you could unshare your slides and we will get on to the Q&A? Okay, so I think that people can still continue to enter their country while we get started. So I'm going to go to the questions here. And the first one, I think, is for Ed. A question from Joan Ejembi. Have you been able to assess the impact of the interventions like eBug and Target in reducing overuse of antimicrobials?
I think Target is very, very new, so I don't think there's anything on. Sorry, eBug is very new, so I don't think there's anything on that. In terms of assessment of outcomes, the one that I found was the one that I described, which was the keeping antibiotics working paper. So yes, it has been done, but I think there's a lot more to do in terms of assessing outcomes. Yeah.
Yes. Dr. Abdel Monem, you mentioned some outcomes that you had found in terms of improvements in awareness of AMR after some of your initiatives that you described. Did those evaluations extend to finding any differences in terms of actual impact on antimicrobial prescribing? Or was it more just around raised awareness?
Actually, it was just about raising awareness. And that's why we need in Egypt much more campaigns with much more focus on different aspects related to antibiotics. Not only the information or the awareness about it, but also about much more details. So we need a lot of activities related to the raising knowledge and education between all sectors.
Yes, yeah. And both in Egypt and the UAE, we heard that antibiotics are available for patients to actually buy over the counter. So arguably, would you say that public awareness is even more important in those countries than in countries where only doctors can prescribe antibiotics?
Of course.
Makes it particularly critical, yes. But I think evaluation of how those initiatives lead to actual reduced prescribing or reduced administration of antibiotics is probably challenging. I have another question for you, Dr. Abdel Monem. When do you expect that the Egyptian National Action Plan will be updated? Carolyn Horner is asking. We noticed that it ended in 2022.
Yeah, this is the last one. Actually, I'm not sure because it is a governmental plan. Maybe in the late in this year. I'm not sure exactly, but hopefully it will be delivered soon to tackle this very important problem worldwide.
Thank you. And another question for you as well from Kerry Phillips. who's saying, great news on restrictions on antibiotic sales in Egypt, much needed intervention. Are there plans to extend the restriction beyond just the reserve category of antibiotics? Do you know?
Yes, I actually, this is the start, and this is a good start because all antibiotics were available for all people in public pharmacies. So to start with this category of antibiotics, this is a good start, and I think every project has a start. Then with sustainability, we can continue and prohibit all antibiotics to be delivered for public in pharmacies without prescription from doctors. Yeah, hopefully.
Okay. So, but at the moment, the plans are just for the reserve category.
Yeah.
And thank you as well to Carolyn Horner, who has put a link there to a published evaluation of eBug, which people may be interested to access. And also a search on PubMed it will also come up with some papers on it. So that's useful to know. Thank you.
Thank you very much.
Right. Our next question is from Professor Taiwo, saying, apart from World Antibiotic Weeks, what are the other means by which the public are being engaged specifically on AMS in Egypt and UAE, especially in agriculture, aquaculture, and animal husbandry, where there's high antimicrobial use? I think, Dr. Abdelmonem, you talked a bit about One Health and how that was a focus of your efforts.
Yeah.
Could you elaborate on that at all?
The One Health, as we know, it's a collaboration between the human, animal, and environment related activities. So this triple is very important to focus in parallel way, not on only one aspect of them. And actually, from as I mentioned in the presentation, this was one of the challenges. In Egypt, we didn't have much more activities related to environment or even to the human raising awareness and education. So the One Health overall as a concept need to be re-evaluated for the next national action plan.
Yes, that's good to hear that will be part of that. Thank you. And another question from Dr. Jog. Thank you for the excellent presentations. Patient engagement is targeted mainly to the community. Are there any specific interventions that any of you are carrying out that are targeted to patients in secondary care? Shall we start with you, Professor Menezes, with that?
Yeah. Regarding the previous question regarding One Health approach, yes, it does make a huge difference. And recently we have started having collaboration with the UK and other countries in addressing One Health approach in containing misuse of antibiotics and the welfare of overall One Health. Yes, and it's been a new concept for us, One Health, and we are trying to make a difference there. And regarding AMS, like we do have a Antimicrobial Stewardship Committee in the country, which are trying to address AMS at the hospital level, whereas we are yet to do a major difference in the community, reaching out to the public. So we have been having meetings to address that, and hopefully we should be able to make a difference at the level of public as well.
Thank you. Ed, have you done any work in secondary care that's patient targeted at all?
I suppose that not really in terms of evaluating outcomes and so on, but in terms of public engagement, I think what we are starting to do now is make sure we use patient information leaflets more. If a patient is prescribed an antibiotic, that's something that is coming, and also specific antibiotics with particular side effects such as fluoroquinolones. We're starting to deploy specific resources for patients, of what they need to look out for in terms of side effects, that kind of thing.
Yes, yes. I've noticed that we've been doing that a lot more. Question from Dr. Patel. Behaviours and cultures of people around the world will be different. Has any work been done on which are the generic and common actions and what varies around the world, which might need different approaches? Wondering whether the World Health Organization may have looked at this. Anybody got any thoughts or comments on that? Because certainly, as well as the different communities and populations around the world, we have different availability of antibiotics, as we already alluded to. Anybody know anything about these different approaches? Any comments on that? If not, then that is a great question, which we will need to look into afterwards to understand different approaches in different parts of the world. Also, thank you for all the new links to evaluations of Antibiotic Guardian. I'm sure people will find those really useful. Thank you for putting those in the chat. And Sarah Chadwick says, we have some great campaigns developed in Leeds with a useful link to that. We've found targeting to small areas based on local insight anecdotally effective. Any guidance on how to evaluate effectively when so many confounding factors affecting behavioural change is welcome. Yes, I think that is challenging. Those evaluations which have the links in the chat, maybe some of those will have some information on that. Has anyone else got any comments on evaluating interventions and teasing out their impact from all of the confounding factors? Anybody got a comment on that? Ed, I was interested in your summer school. Can you tell us a little bit more about that and what evaluation, if any, you've done on that? That's a very local initiative, I think, isn't it?
Yeah, it's very local. So it was over one day, and I wasn't there personally, but I've heard about it. So it was setting up almost like an OSCE style setup in a school hall, where each station would have a different patient, and then one of my colleagues would be the patient, and then the student would be guided by someone else to ask questions and take a history based on, they were given the answers, but they had to kind of take the history and get the story from the pretend patient in each case. So yeah, it was just trying to engage students in infectious diseases and antimicrobial stewardship, and hopefully give them some career aspirations as well. But yeah, overall it was evaluated. I think we scored more than 4 out of 5 overall. So yeah, we did quite well with that. Yeah,
if that sounds like something very doable, but that would be quite practical to do in lots of settings, and quite a feasible project for engaging with schools and engaging as well. Yeah. Oh, interesting. Thank you. So moving on now to the information about the series and about next week and the week after. All of the webinars in this series will be recorded, and they'll be stored on the college website within the international regions section under this category of virtual resources, where you'll be able to find them. We aim to upload them around 2 weeks after each webinar. The next webinar will be on the 3rd of July, where we'll be exploring developing prescribing guidelines. And there's a link there that you can use to register. It's on the website as well. Just to keep you aware that the international team is also delivering International Pathology Day on the 6th of November. And the theme this year is on the the rise of antimicrobial resistance globally. So if you're interested in joining that, you can also register for that from the college website. We will be sending around a brief feedback form after this webinar and would really appreciate your feedback on this. It's very short and quick to fill in. So it just remains for me to thank our speakers very much, Dr. Edward Bevan, Dr. Riham Abdelmonem, and Professor Godfred Menezes for their excellent presentations and insights into activities in your respective countries. And huge thanks to Giles Hanratty from the college's international team for putting all this together. I know it's been a huge amount of work. It's run very smoothly, so thanks to him as well. And lastly, thank you all for attending. We hope to see you in the following 2 weeks' webinars. Thank you very much and bye.
Thank you.
Thank you.
Bye.